The 74-year-old singer was pictured attending an investiture ceremony at Windsor Castle earlier today, where he was made a member of the Order of the Companions of Honour by the Prince of Wales. The award, which recognises his charity work in the fight against AIDS, is the second royal recognition the singer has received following his knighthood in 1998. However, this time around the singer was worryingly seen using a walking stick in order to support himself after his hip surgery. Pictured outside Windsor with his partner David Furnish as he displayed his award, the singer also gave a small update on his health to Sky News. Elton said, "I feel very blessed and very lucky. I have had an amazing life. I may not look as if I am 100% fit, and am not quite, but I am still raring to go, and I have a lot more work to do as long as my life goes." Despite not being on top form, the singer has remarkably improved health-wise since his last interview with Lorraine, where he said that he was in pain most of the time. Dementia diet, the common food type you should eat every day to lower dementia risk. The star appeared on the early morning chat show after it was announced that he had to postpone his farewell Yellow Brick Road tour until 2023, after falling whilst on holiday and landing on his hip. Lorraine asked, "Nobody is more upset than yourself about having to cancel the tour. I know that was a really tough decision. Are you okay? It must be very serious for you to not be touring." Elton replied, "I can't move sideways, I can't get in and out of a car. I wouldn't be 100% fit, I wouldn't be 100% confident because I'm in pain most of the time. The decision had to be made because I wouldn't want to go on a stage and give less than 110%. I don't know, with a year and a half of touring, how long my hip would last. It probably wouldn't." Claire Balding Health, presenters battle with deadly condition. Cancer is scary. Insight supplements, the best supplements to reduce joint pain, stiffness and swelling. Tips: the 2-minute exercise that could improve high blood pressure. Dr. Michael Mosley, expert advice. Despite intensive physio and specialist treatment, the star had to have an entire hip replacement, but continued to say that it was the best scenario. He said, "Better to get it done now and unfortunately disappoint all the people, but I'll make it up to them and I'll be in much better form." To Elton, and his fans' joy, the hip replacement was a success, with partner David taking to Instagram to share the news. The post stated that the hip replacement had been a massive success, and showed a picture of the hitmaker in a robe celebrating his single Cold Heart reaching #1 in the official UK charts. The NHS explains that a hip replacement is a common type of surgery, where a damaged hip joint is entirely replaced with an artificial one. Although adults of any age can be considered for this type of surgery, commonly individuals aged between 60 and 80 have the procedure. The new artificial hip is designed to last for at least 15 years, as well as significantly reduce pain and improve the range of movement for the individual. Since having his surgery, Elton has been doing everything he can to get him back to full fitness, ensuring that there are no long-term complications. The NHS continues to explain that the amount of time taken to recover from a hip replacement can vary from person to person. After an initial stay in hospital of 3 to 5 days, individuals are discharged. Like Elton, most people use a walking stick or crutches to help them maneuver, along with doing exercises assigned to them by a physiotherapist. Although the risk is low, complications of a hip replacement can include hip dislocation, infection at the site of the surgery, injuries to the blood vessels or nerves, deep vein thrombosis, a fracture in the bone around the hip replacement during or after the operation, differences in leg length. If you are experiencing severe hip pain and stiffness in your joint, it is advised to seek medical help as you may be offered a hip replacement. Furthermore, if this pain interferes with your quality of life and you find yourself feeling low as a result, make an appointment with your GP as soon as possible.